Welcome to today's webinar, Obesity, a widespread societal problem. Indeed. It's not just obesity in a physical sense, however, that we'll be discussing it, but a metaphor for the excess that burdens individuals, corporations, and governments. We know the problem, but acknowledging it is not enough. Real change often requires a shock. Think Donald Trump, or COVID for that matter. Whether it's a health crisis, a corporate collapse, or an economic meltdown, trimming the fat is rarely voluntary. At the personal level, obesity doesn't just happen overnight, it builds over years of poor habits, small indulgences, and ignored warning signs. The consequences can be severe: diabetes, heart disease, and a diminished quality of life. Financial obesity follows the same pattern. Debt piles up, savings shrink, and before long a person is financially trapped, or the organization for that matter. It often takes a sudden crisis, a job loss, a market loss, a new innovation, a medical emergency, for real change to begin. Businesses, as I've alluded to, can fall into the trap of excess. Bloated bureaucracies, reckless spending, and unsustainable valuations create the illusion of strength and longevity. But when economic downturns hit, over-leveraged companies collapse. Bankruptcy isn't an accident, it's the inevitable outcome of neglecting to stay lean and adaptable. And then there's government. Public institutions expand, deficits swell, and economic systems become overburdened. History warns us that ignoring the signs can lead to recessions, market crashes, or worse. Devaluation of the dollar has happened several times in the course of the U.S.'s history. Reform only comes when a crisis forces it. Again, think Donald Trump. So tonight we ask, must we wait for catastrophe to act? Or can we take control, shedding excesses, building resilience, and ensuring a future where individuals, businesses, and governments don't just survive, but thrive? The children, in the course of their education, have the resilience to accept and embrace change as a form of continuous learning in the course of their lives. If we choose to act, the impediments to change, the innovations we've resisted, must be embraced. So let us begin. We've brought together in a panel Dr. Sabrina Kwon, who is in obesity surgery, and I'll ask her to do a brief introduction. Then I'll go to Dawn Ringrose, who will be representing organizations and corporations today, and then Peter MacKinnon, representing the public sector and government. So, Sabrina, your interest in not obstetrics, I may well have said that in error, but obesity, and your background. Give us a little bit of color and what brings you here today.
Sure. My background is actually in general practice, and so I fell into obesity. I am not a surgeon, just so that that's clear. I do assist in the operating room with bariatric surgeries, but most of what I do is actually medical obesity management. And I think it was interesting to me because it was such an issue, a growing issue, that nobody seemed to really understand what the solution was. And there were so many people that were struggling, we weren't really sure how to help them. So it remains a bit of not a mystery. We're learning more, but there's definitely much more to learn about it.
I became aware of how significant the issue was when we were dealing with some discussions of cell therapy in people with diabetes, and the rampant rise in obesity and diabetes in Asia, for example, as a byproduct of dietary shifts. You must be seeing that obesity actually follows some shifts, whether it be new products coming to market or changes in diet. You must have had a little bit of a history of what prompts obesity and the increase.
To be honest, I think the real root of this, when I speak with people on a day-to-day basis, is just misplaced priorities. Yeah. Not understanding what is actually required for the human body to live well. Stressors, again, from misplaced priorities, leading to things like emotional eating, for example, stress eating, and just lack of education. Our education system is not great for nutrition. talking about change, the need for change, evolution. The Canada Food Guide is fantastic. It is, theoretically very, very good, very solid, but the number of people it's actually helped, I'm not so sure. So it's just, yeah, misplaced priorities.
Yeah, food guides often look like a token. Dawn, your background and your interest in the topic of, well, call it obesity or call it organizational excess. Give us a little bit of color of your background.
My background is primarily management consulting, and although there is an entrepreneurial stream running through there with a number of businesses I've been involved in, and my area of specialty has been in business excellence, which means helping organizations to run as efficiently and effectively as possible. So if they're wanting to improve their performance across a balanced system of measurement, I'm in there to assist them with doing that. And I've done this sort of work at a scaled level too, whether it's working with a province, working with a country. And when it's back to the organizations, it's everything from, micro, small, medium, and large. So it's really been interesting to take a look at organizations and where they're doing well, where they need to improve, and then to just assist them in getting to where they want to go.
Some of the pushback I got when I cited obesity as a metaphor was from the corporate sector that said, well, we don't have any issues of obesity. How did it hit you when you heard me raise obesity as a metaphor for corporations?
I thought it was a great term. I thought it was kind of provocative and it would get people's attention. And I think there is a lot of fat or there is a lot of excess,
Yeah.
particularly as organizations grow larger, and it can really bring them to quite a grinding halt. Do you know? So I think when you're looking at running lean and mean, you're wanting to get rid of that excess, the rework, the errors, the duplication, people doing things that don't align with the vision, mission, goals, and objectives of the organization. So I think it's pretty healthy for organizations and their employees to learn more about this and be engaged in it, in all working together towards that common aim of making sure that their organization is as high performing as possible.
Well, it was Peter Lougheed, Peter MacKinnon, who said to me, it's easy to manage and to govern during periods of austerity. It's extremely difficult to manage when there's a lot of fat around. In other words, the economy is doing well. What's your background and how is it that you came to appreciate this topic?
I have a very eclectic career, as some of you know. So I've had experience working in the public sector, private sector, and academia, as well as in the not-for-profit world and within international organizations as well. So I've seen things from various perspectives. And I tend to have a lens that I look at through change management and trying to improve the efficiency and effectiveness of organizations, including all of the above in terms of public, private, and so on. So I'll share some comments. As we agreed, none of us are experts specifically in the subject area of the metaphor, at least in terms of trying to describe the nature of government from the point of view of obesity. So I feel that is quite an interesting challenge, and I'll see how it comes out today.
Okay, so I'm just gonna ask either one of you to jump in. I'm gonna pose question number one, which was really focused more on personal obesity. Not that we've all got experience in it as a physical entity, but how significant and widespread is the problem? I'll pose this to Sabrina, and I did so really during the introduction, but how significant is this problem of personal obesity, which is really your market, if I can use it, the business term, Sabrina, considering its implications on personal health, chronic diseases, healthcare costs, life expectancy. So from a personal point of view, it can have pretty serious consequences, but how rampant is this? Is there a growing and a huge market for treating obesity. And in addition, it has socioeconomic impact. If an individual is no longer productive, they've been sentient for many years, or their body just can't handle the level of productivity that was once the case, or their marriage, or their capacity to earn a living. So what does this mean for workforce productivity and economic sustainability for a nation that may well have, and talk about obesity at an epidemic level, which is what Kennedy is saying is the case in the US? Give me some color.
Well, the rates of obesity are definitely rising. We see that actually globally, but certainly in Canada, I think now the numbers are about 66%, so 2/3 of the population are either overweight or have obesity. The rates of obesity in children is also rising over the years. That's very apparent. And then, of course, the medical conditions that come along with obesity, we're starting to see in children, like diabetes. There's certainly an impact in terms of productivity. So not just absenteeism, but the idea of like presenteeism, people just not functioning at their best at their job because they are unwell. And I think we see also a lot of the other services in healthcare, for example, things like orthopedic surgeries, cardiovascular interventions. A lot of these are on individuals that are struggling with their weight. And their weight is a factor in why they need to access these other healthcare services. So from a sustainability perspective, I would say for the healthcare system, it is not sustainable to ignore obesity as a true chronic medical condition that results in a number of other conditions that then impact the individual and the kind of country as a whole, productivity-wise.
So it has broad ramifications. Certainly for the individual, it can lead to serious debilitation. And if on a rampant scale, or what they would refer to as epidemic, it has socioeconomic implications as well. Dawn, from a business point of view, looking at obesity as a metaphor, are we seeing excesses in the business sector? Are businesses today more vulnerable than maybe they were 10, 20 years ago? Is there something going on in this sustained success that we've had that has led to anything like obesity in the corporate sector?
Yes, very much so. A lot of organizations are engaging in what we call non-value adding activity. And these are things that their people are doing that don't align with the vision, the mission, the goals and objectives of the organization. Yeah, so it's taking their activities are taking the organization off course. And it's estimated at about 20% of operational costs in the manufacturing sector and up to 40% in the service sector. So if you imagine how much that is, of all the organizations in Canada, and the fact that they might, let's just take an average between the two, of 30%. If you think that 30% of their organizational costs are being spent on things that really don't add value, and that with a good management system in place, you can reduce that to maybe 2 to 5%, because there's always going to be a little bit of slack in the system. Just imagine the savings that are available there, time and costs that can be applied to other things that you want to do. And it's really important for any leader too, to get all of their people, whether it's their employees, the suppliers or partners, all aligned and working towards a common aim and focused on the things that are going to add value. So I think there's a tremendous opportunity there for organizations to take a closer look at how they're working and make the necessary changes.
It's very interesting at the corporate level. A leader will say he's successful because the company is growing, and they'll bonus him, maybe in the hundreds, maybe the thousands, maybe in the billions of dollars, because the corporation is growing, and success is now attributed to the employee or the employers. And yet, those that have studied leadership say you really don't test leaders until you're in a crisis. And real leadership is how do you get out of a crisis, whether it be in behavioral change for someone with obesity, or behavioral change for a corporation that has lived on the fat for a long while, or lived on success and really never faced adversity before. Does that ring a bell?
Oh, yeah. I think when we do work with leaders, they're each and every time they're surprised about what's going on in their organizations. And I often hear them say, "Oh, I had no idea that was going on. That's something that we can address right away, something that's really going to make a difference." And so that's the beauty of doing an assessment against what we know is common to high performing organizations. So that leader and their employees can all weigh in on that, and they can see what's going well, what needs to improve. And out of that comes some amazing improvement opportunities that really helps them work more efficiently and effectively. And actually, the changes that they see, good changes and results, they can see them pretty early on,
Okay,
you
well,
know, and
that,
it's
that, that,
it's quite amazing.
that's an intervention, and we'll get into discussions
Yeah.
of what
Those are
needs to
right.
take place besides just standing on a scale or getting an audit report in
Yeah.
order to bring about real change. But Peter, success often leads to complacency. Um, we've seen a string of successes of governments that may run through one, two, maybe three elections, with government feeling that it's got a mandate to do almost anything. Uh, do you see, or have you seen, or can you comment at all about whether government at municipal, provincial, we got lots of government, federal levels, even internationally, success leading to complacency, to excesses that ultimately have a cost or become
Well,
difficult to eradicate?
in answering your question, both in terms of what I was going to say today and this current question, I decided to cast my thoughts about governance of government and obesity within that context that we're talking about here, within the context of the Overton window. Now, the Overton window, for those who may not know this term, is basically a geopolitical tool. And think of it as like a window, and it can open and it can close in a horizontal sense. So on the left side of the window is the extreme left, and on the right side of the window is the extreme right, and in the center is the center. That window can shift both left and right, more to the right end or more to the left end, as a country's geopolitics evolve, and it can be managed to move in certain directions by the basis of the politics, such as we see the Overton window in the United States is clearly being directly shifted to the right by the policies we keep hearing daily. So that's a way of looking at how a government can manage its policy environment, which means including how it should grow or shrink itself. And I find that there's an interesting correlation between the shifting of the Overton window and a need to either make the government organizations more robust or, straighten them down and, make it a little more restrictive. So that's just some opening comment. I'm going to comment about it through that kind of a lens.
Yeah, we certainly are living at an interesting time where, at least in the United States, there is an attempt at radical surgery. Um, it appears it's underway or taking place even without a lot of empathy to say we are in a serious crisis. And we've talked about that crisis of the $37 trillion debt. Canada has debt too. Are we sort of slow off the mark of beginning to address some of the excesses that exist in Canadian governments?
Well, I think that the debt issue is actually something that's in transition itself. We've typically thought of, and the general public in general thinks of this still to this day, that your national debt is backed up by a pot of gold. Well, we're not on a gold standard anymore. We haven't been for some years, but people still think that. So that what is really happening today is that debt, a country is accumulating debt because it believes it can continue to be productive. And so it's shifted from being a reserve of something, fixed gold, to being no reserve whatsoever. You can have a debt ceiling or no ceiling at all, as long as your economy is functioning and creating value, then you should be able to accumulate debt. Now, would suggest the U.S. is in excess in terms of debt because it's an extremely high per capita now debt limit on any American compared to other countries. But I think that this idea of debt, as we've just known it in terms of being backed to national level, being backed by a pot of gold, is no longer valid whatsoever.
Yeah, well,
It's about the state of the economy.
debt is also future obligations, whether it be entitlements associated with pensions, or whether it is just sustaining a workforce that in the public sector has grown to 50% of our economy is public sector. And I know that's health, education, and governance itself, but at some point in time, dips occur. And if you're not prepared to make the adjustments to handle those dips, you carry that through more debt and you carry the public sector without making any accommodations, and it grows. At some point in time, size does matter. So I'll leave it at that. I'm going to ask each of you, though, to give some thought to what can be done if obesity exists as a metaphor at the personal level. There must be some counseling that occurs. There must be some things that could be done in the food industry. There are things that could be done in the classroom. Dawn, I'll ask you whether or not auditors or training or new certification. And Peter, I'll ask you the same question. Economic developers are taught how to develop, but they're not taught how to close down an economy or close down a community. So Sabrina, what would you say needs to be done differently in order to address this obesity epidemic that seems to be growing in the personal level?
Well, it's probably maybe not the answer that's expected, but I think there needs to be a public service announcement, quite frankly. I do this day in and day out, and I feel like a broken record. I'm giving the same advice over and over to these individuals. I really do think that there is a lack of nutrition education, proper nutrition education. People don't actually really understand like what their bodies need to be healthy. And so they're just sort of going with the flow. You know, when we talk about what's available in terms of commercially available foods, a lot of what is pushed and advertised and marketed is actually not food that is particularly nutritionally sound. So I think just education, also kids. I have young children. What they consider healthy foods in the school is not really what I would say I would recommend to patients. So just even a global kind of better understanding of like what the human body needs to be healthy, I think would be really helpful.
Well, sugar is in everything nowadays. It seems that it's a sweetener, it's attractive, it's great on Valentine's Day. I love my cake. As a baker in retirement, I use a lot of sugar. And it seems that the first thing a grandparent does with a grandchild is give them a sweet. Kennedy says he's going to address the epidemic with regulating the food industry, attempting to make some adjustments and taxing as they tried in New York and other places calories. Do you see those things emerging as a possible way to address obesity, or are we just getting started? This is like smoking and not knowing quite where to go. Do you see some dramatic or innovative things being done like that?
Well, I don't think we've seen a tax yet. I know they've talked about it quite a bit.
Yeah.
I mean, I feel as though if people don't understand what the issue is, like the general public don't understand like what is the issue with, you know, sugar? Like why is that an issue? Why do I have these sugar cravings all the time? You know, and then just say, well, we're going to tax it and make it more expensive for you. It's a bit punitive without them really understanding what the problem is. So I don't know how helpful that will be because people will still be reaching for those things. They'll just be angry that they need to pay more for it.
It's interesting, but punishment doesn't eradicate behavior, it simply suppresses it. And it's the first opportunity to get around it and sneak a cookie. That's exactly what takes place. Dawn, what in your sector, do we need more auditing? How do we shock companies to becoming aware that they have issues before those issues absolutely bring about a catastrophe?
I think it's a similar situation. I think there's a fair bit of ignorance about, you know, let's say what is common to high performing organizations. how do they operate, and what's common to them, let's say the practices that they use. And our global research would suggest that only 20% of the working population knows about this. It's one of the best kept secrets that shouldn't be. And I think I also see it that leaders in organizations have a tendency to look at quick fixes for the issues that are confronting them at the expense of a kind of a platform that'll provide long-term success. So it's they're being distracted, I think, by a lot of different offerings. And unfortunately, they don't learn about this wonderful comprehensive whole that they can be using if they spend a little time implementing it. It's really going to bring them benefits over the short, medium, and longer term. So it's one of education, I think. Is let's make people aware of this. Let's ensure that they understand it and can work on applying it and reap the benefits.
Well, there's certainly work being done by talking about trying to get corporations to think about sustainability in the long term, and for boards to stop thinking about those short-term stock market profits or quick gains by price increases and manipulating the market and the consumer. So there's certainly talk, whether it was ESG or sustainability development. It's out in the open now, where the companies will really pay attention when profits continue to be the driver. Peter, government. Great big giants. I mean, we seem to be talking government all the time, and we're talking trillions of dollars now, not just billions or millions, as was once the case before. But when government faces a problem, it faces a problem today in the trillions of dollars. You would think that it's relatively easy to get attention when $1 trillion is at risk. I know they're talking to Elon Musk and saying they expect him to shave $1 trillion off a budget when they're running $1 trillion deficit each year. And Trump says he's going to try and get a balanced budget again. Wow, wouldn't that be innovative in government? So what do you do to get government to start paying attention other than a radical change in leadership? And maybe that is the answer.
Well, as I said earlier, I think the U.S. is an extreme example of a debt-ridden country that actually manages to keep its head above water because its economy keeps chugging along. But if its economy starts to shrink, such as the tariffs may cause this to happen, then the United States could easily spiral into a serious depression. And I think that this is the danger of what Trump is doing right now in this wild riding of shooting from the hip issues about a tariff. Now, tariffs are different, as you can appreciate, than a sanction. A sanction is binary; it's either on or off. A tariff, you can crank it up or down, and this is exactly what Trump has been doing. So he's creating maximum confusion because he can crank it up and down, you know where he's going to stop. And then suddenly he relaxes it. And so whatever drives him to relax it, that decision making is not conventional government decision making.
Right. So it's not conventional.
He is decision making by party of one.
Right.
And he gets his accolades to agree. So I see it as quite a different kind of fuzzy government right now in the U.S. than what we see in traditional democracies.
I'm going to do something tricky here, Peter. Talk about that from a positive perspective. What has happened as a byproduct of this unusual, unconventional? I mean, convention hasn't worked in terms of getting government to stop its park barreling and running of debts. Is it conceivable that this option is really the only one that was left to get people to start addressing real change in the U.S.?
I don't think that's going to address the real change because, as you probably are aware, they mark up almost every bill with specific interests from a particular senator or representative who's sponsoring the bill or is on the committee of the bill. So, they already have a kind of a rigged system for directing federal funds to specific initiatives that are pets of individual members of the House.
So is this unusual for Canada, for the United States? This doesn't happen in Canada?
Well, it is not a tradition in Canada, nor in the Westminster system, to be able to mark up a bill with specific, personal interests.
But pork barreling does
It's
occur.
a kind of pork barreling, but in a different way.
Yeah.
I think our pork barreling is our notion of having to deal with, regional equity.
Mhm.
I think one of the things that is interesting, you asked a question about the Trump's disturbance and how it's affected some countries. Well, I'm interpreting your answer here or your question, but I'd say it's been somewhat positive for Canada because we've had interprovincial trade ever since I can remember.
Right.
And we're now seeing that the provinces are starting to talk about let's take down the barriers of interprovincial trade. One of the perfect examples is that of, people who are professionals, doctors, lawyers, dentists, surveyors. They now can actually practice anywhere in Canada. This is the new rule they're working on, the interprovincial trade barrier coming down. Okay.
This was in a way what I mean, we've addressed this in earlier webinars with Bill Jones, is the shock and how the silver lining for Canada has been finally addressing long overdue issues such as interprovincial
Yes.
trade, issues of defense, and even our relationship with the US. Although I would never want to have a partnership with an organization that throws agreements away willy-nilly. So unless there's a crisis. How serious is the crisis in the US, and does that justify all of what's taking place? So I'm going to get back to companies gorging on excess. As individuals struggle with overconsumption, corporations have become bloated with monopolistic power. I'm startled to see the CEO of Tesla asking for multi-billion-dollar bonuses, executive excess, speculative investments. I mean, I can't believe what sporting characters get as contracts any longer. But and then the speculative investments, whether it be Bitcoin with no substance to it, or cryptocurrency for that matter, we see speculative investments, we see corporate gorging. How does corporate obesity through stock buybacks, CEO pay inflation, monopolization of industries mirror the same patterns of overconsumption and short-term gratification that fuel personal obesity? Should corporations be forced onto their own diet through stricter regulations or incentive to reinvest in long-term economic health? You've touched on this, Dawn, really from an educational point of view, but at some point in time, does government need to step in with antitrust legislation? Is what we are seeing, is the government neglecting its role in regulating the market?
Well, I think that consumers need to vote with their wallet. I think what we see is a fair bit of excess. I think it's tending towards hedonism as time goes on. The flagrant abuses. We hear about cases in the media like Enron and General Motors and McKinsey and big tech, and how they're manipulating things or behaving unethically, um, pushing things that are unhealthy for the population. And I must say, in the last couple of years, I've had some real issues with some larger companies, um, GFL, Visa, and WestJet, to name them.
Sure.
And horrendous experiences, and I've taken the time to write a letter to leadership, just to outline to them the experience and the negative impact it likely has on their company and their customers, and just ask them what would they do to address it. And the shocking thing is I didn't even receive a reply.
Well, I
And
recall, I
and
recall,
I look at their complaint statistics, and they're off the charts, some of these outfits.
but,
And
but,
I think to myself, in dealing with them, I mean, it's issues of ethics, training. It's things that, I think could be pretty easily remedied and are probably resulting in an awful lot of complaints. I don't know how they're handling those complaints, but that's usually going to affect them pretty drastically in the long run. Not just myself who probably feels like this. There's other customers that will vote with their wallets too.
I recall some years ago consulting to the telecommunications industry during the point when privatization was underway, and government telecommunications companies, whether it be EdTel or TELUS at the time, being transitioned to become a private sector operation, and therefore subjected to market forces instead of just the regulator. And pointing out to them that in this transition, the consumer and consumer attitudes and consumer behavior were likely to become increasingly important to that organization.
Yeah.
And I was told, BS. We make our living by negotiating with the regulator. The regulator is who we invest our time and effort in. And I was stunned. I was naive enough to think that market forces were going to be important. And I'm not sure that CRTC still isn't the primary determinant of how the telecommunications industry operates in Canada. So what seems to be failing is a government's role as a regulator in order to discipline excessive market abuse. And we've talked about in the food industry as well. So at a time when government seems to get elected by taking on a position of deregulation, there are certain sectors where we clearly need more government intervention in the market, which is excessive. So Peter, I'm providing an opening there for you that the role of government is extremely important in a market-driven economy in order to make sure that market excesses are addressed. And yet, government seems to be failing us there. That's a form of abuse.
With respect to telecommunications, I can make some comment there because I'm more exposed to that particular area. I do think that the CRTC is being kiboshed by the telecommunications companies. I do not think they're serving in the best interest of the citizen of the country and in the best pricing that's possible. We have among the highest prices in the world for internet service and telephony service. And yes, we have big geography, but I mean, much of this stuff travels at the speed of light through the air or through fiber optic cables that are not very expensive. So, I mean, this excuse about the infrastructures, because we're such a big country, has got to have more rate per capita is, I think, a bit absurd.
Well, it just
So anyway, this is a regulation issue, but it does affect the rate of, in my view, it affects the rate of innovation because the telephony world is basically going all digital. And the so-called G6 that we've been hearing so much about, it's really not for the latest generation phone. It's about Internet of Things. G6 is all about the Internet of Things, or 6G. So it's all about telecommunications and connecting devices. And there's going to be more and more devices, and that's going to be a regulation issue because these are going to be billions, and they're going to be in all kinds of places that can be inferring privacy as well as security, as in a building security, for example. There's lots of unresolved things that are coming in the digital world.
In an earlier webinar, we talked about trafficking, drug trafficking. We talked about corruption in real estate. But we noted that the money laundering was a byproduct of a problem with the banks being complicit. We now have the possibility of a banker becoming a prime minister at a time when we're hoping to see some banking reform. I'm not sure that he will want to challenge his buddies in an industry that he's come out of. Sometimes we seem to hire doctors to run the healthcare system that are reluctant to upset their brethren. I'll leave it at that because that could be a criticism of almost all the professions that seem to have a lot of difficulty, even those that are self-regulated, of taking action. The teachers' unions in particular, you talk about bloat and excesses. We were counting the number of days that teachers now have for professional development and wondering how much time there is for the kids' development.
For teaching, yes.
At what time does the union have nothing left anymore to negotiate for? That's excesses. So coming back to government growth and essential services, I mean, government at one time was about governing. It seems to be now more about public services. In other words, its primary role appears to be no longer one of governing, but more of managing public services and giving and using the ease of printing money or of taxing in order to elevate the number of services offered. Health.
I would suggest, I would suggest that public service is a consequence of the policy of governance. I mean, the governance, you make policy and then you implement services and you deliver those services, you fund those services as well. So there's a whole chain there. But it strikes me that that's an endpoint of governance, as in then you evaluate and continue to reform or replace.
Well, I mean, going back a century, it's a relatively new development, and it occurred literally throughout the world as the welfare state in order to handle some of the issues of communism and socialism and back around World War II or the causes of World War II. We have seen government services grow exponentially in the last 50 years. And we've seen
Yes.
debt to serve the baby boomers who were very demanding in that period. We now have debt. We've got some wealth transfer that may be taxed, but over time, bureaucracies expand in complexity and cost. They become systems, often outpacing their ability to deliver efficient services. And we see that just monitoring waiting lists, for example, and then arguing we need more supply. It's always more supply. What are the risks of unchecked government expansion, and what should reforms focus on to ensure leaner, more effective governance without undermining essential public services? Is there a point in time where management says it's time now to inject market forces and the needs of the consumer instead of the needs of the supplier? Are we done building these systems and finally turning them so they can become more consumer efficient and consumer responsive?
If I may, Perry, I looked at Canada's back 30, 40, well, but roughly 50 years in the sense of our governments changing and those that tried to change the nature of the public service. In other words, to diminish it or it expanded. And it's very interesting. Number one is that it didn't matter which party it was, as in the conservatives or the liberals, they both seemed to take action when they felt it was necessary to downsize the government. Their reasons were different in some cases, but their actions were the same and were for the same reasons, basically. How they described it is another issue. However, although I might suggest the trend in when it expands, it tends to be a small L liberal kind of government as opposed to a conservative kind of government. It doesn't expand in any big program sense under conservatives, although it does expand under liberal program. So those are a couple of factors. And again, because of if you're expanding your Overton window, in effect, you're also having more policy options in that window. More practical options are available to government. If it's a narrower window, then there's less options because they're going to be more specific to a particular ideology. So I think that, with a broader window, which is what I think our new prime minister, for however long he will be prime minister, is not your normal banker. I think he's an unusual character from the point of view of an experience that he has that is, I think, will be well balanced in his taking on the mantle of leadership in the country at a political level. Tested as a politician, no, he hasn't been tested yet, but he seems like an amiable guy. Doesn't seem like you're stuck up banker.
Austerity and purging of excesses and getting rid of programs that were good for the past, but maybe not good for the future, is extremely difficult. Politicians have said to me numerous times, the last thing you want as a politician is to introduce shock.
Mm-hmm.
And if shock is called for in order to bring about change, it's an extremely difficult thing for leadership to introduce. The carbon tax was a shock, and a price may well be paid just by way of example. And we've seen that over and over again, that the fickleness of the market, When I was a consultant to Ottawa back when Mulroney had just been elected and the Eric Nielsen Task Force was established to look at opportunities for austerity, to introduce a program of austerity, and those plans were brought forward and Mulroney didn't act upon them. And the reason he didn't act upon them was he had just been elected and was anxious about losing his mandate. We're facing that right
Well, look at
now.
Mulrooney lost when when that cycle ended. Mulrooney was devastated. I mean, the
Yeah,
party was crunched,
yeah,
just absolutely crushed.
yeah. So drawing parallels, what lessons can be shared between sectors? Obesity, whether personal, corporate, or government, is a crisis of unchecked growth and overconsumption. What lessons from addressing personal obesity can be applied to corporate and government excess? Could policies like tax penalties, incentives for efficiency, cultural shifts toward moderation work across all three sectors? Or ultimately, do you simply need a leader that is prepared to execute shock and say, I am prepared to be a 4-year leader or a 2-year leader or a 1-year leader, and I'll take the consequences in the voting booth, but this country or this corporation or this person needs shock treatment. As you listen to us, Sabrina, and this is not your field, I know that, but as a citizen with a good brain on our head, on our shoulders, do you hear things that we're discussing that you see at a personal level of reluctance to change, the necessity for third parties to be brought in to talk to a client? How does what you deal with at a personal level echo other topics that we're talking about?
I can say for sure in earlier positions in the hospital setting, definitely that need for evolution and the resistance to change was very apparent, and how that leads to inefficiencies. So I definitely see that parallel. I think in individuals, with obesity, I think it's just, again, a lot of it, I don't know if it's about, for example, like the physician, shocking the patient saying you're going to die, from a heart attack at this age if you don't do something about your weight. I don't know how effective that is. I really do think it's about education and helping the individual connect the dots, them understanding the difference between needs and wants, and then also understanding why is it that I want this and why is it that I don't actually need it. Trying to affect behavioral change more from that angle as opposed to like a fear angle.
So while a doctor may exercise empathy, I mean, there's a relationship there. It's just not bringing and imparting knowledge, but that knowledge is not likely to be accepted if there isn't some degree of a relationship, and I'll call it empathy. Would a doctor ever say to a patient, and I'm not asking you personally, but look, I can't help you because you're not helping yourself. I'm going to have to discharge you. I will have to refer you to another doctor.
Hmm. I'm sure that has been said many times. Actually, I personally would never say that. I think what I see over years of practice is most people really are doing their best, given whatever their circumstances are. And for most of them, it's a matter of finding how can I help them in their current circumstance to get them a little bit further ahead, to give them that leg up that they need. Because I don't find that people are generally behaving the way that they're behaving because they're not interested in improving. Usually it is they are very interested in improving, but they have certain circumstances that need to be addressed. And sometimes I can help them with that and sometimes I can't. So usually my conversation with them is more, I see that you're struggling with these aspects. Maybe now is not the time for me to be a part of your solution, because this, and this needs to be addressed. So maybe go and address these things. When they're better addressed, come back to me, and then I think we'll be better able to work together.
Okay, so you're seeing someone who has acknowledged the problem and is seeking help from you in what to do about it, implying that they're prepared to act. Dawn, in consulting, it's always nice to be hired by a company that has acknowledged a problem as opposed to asking to do a pure diagnosis. I mean, auditors do diagnosis of problems that they think may exist in an organization, hand them in, and hope that the organization will follow them. But when you hear what we're talking about here, acknowledging the problem in a corporation is one thing, auditor generals, consultants, but getting them to act upon it is another. Are there things that you think need to be introduced in order to facilitate behavioral change before it becomes a crisis?
Well, what I've found works really well is getting everybody on board, you know, working with the leader
Mhm.
to invite the employees to be involved in self-assessing the organization, you know, on all these practices that should be in place. And employees are wonderful at identifying what's going well and what isn't. And they've even got great ideas and suggestions, and some can be really, really innovative. So that is part of it. And to me, we should really be celebrating organizations that are doing well and always striving to improve. I think sometimes we celebrate the wrong things. We might celebrate the greedy and the not trustworthy organizations in some of what we do. And I say, well, what about those organizations that are treating their employees well, that have got healthy workplaces, that are giving back to the community, that are always striving to get better? I think sometimes we need to kind of shift the way we look at things and make sure that we reward the things that we want to see done, right? And recognize and celebrate those that are performing well.
You've got,
So
you
I
must
think
have,
it's all about incentives and recognition. I think those are very powerful.
you must have psychology in your background. I mean, reinforcement learning has become the rage in artificial intelligence, and certainly should be in the
Yeah.
corporate sector. And I suspect in obesity consulting as well, is to reinforce the right things. Peter, you got your finger up? Go
Yeah.
ahead.
Yes, I was going to add to what Don was just saying, and it's a view that I've had for several years, primarily developed as a result of leading the investigation at the University of Ottawa into the collapse of Nortel. I'm of the view that large public corporations should actually have an office of the board, where the office of the board, because the board members of these large public corporations tend to be the same crowd that circle around many large public corporations. And as intelligent and as dedicated as they may be to the cause, there's only so much time they can read all the stuff. So an office of the board could be a neutral place to give advice to the board independent of the management's advice, because management could snow the board sometimes. And if there's an office of the board, they can actually see through that stuff. And I
Interesting.
suggest it can have a massive improvement in the efficiencies of the operation of large public companies, having an
Efficiency.
office of the board.
There's a department of efficiency being considered or being introduced.
Well, I was dodging that one.
I thought dodging, yes, very apropos. So I'm going to turn the discussion now over to the audience and ask the viewers if someone wants to speculate on or comment on what might be done. You've heard that this issue of obesity, in a metaphorical way of speaking, is endemic. We see it at the personal level, we see it at the corporate level, the government level, and we talked about various options. We talked about how serious it is. Jeff, I know you worked in HR. I remember being told when I had an interest in possibly getting into HR management that I wasn't mean-spirited enough, that you needed to be rather tough in HR because you had to deal with people that weren't necessarily wanting to be treated kindly. And I experienced that when it was necessary from time to time, but it did happen when I had to let someone go. You might fire them.
Yeah.
And my strategy was typically to take them for a ride in the car and have a discussion that you're not happy here and I'm not happy here. You've got 30 days to make a decision. At day 29, they asked me if I was serious. I could never get a person to take initiative, giving them an early warning that it was time to move. So I began to understand why it was necessary to take their keys and walk them to the door and appear to be rather unempathetic in order for them to get the message that time was over. Jeff, you want to step in there?
Well, I'm just going to say I've done that. I played that role many hundreds of times in many different organizations. And back to Peter's Overton window, a lot of that role depends on the individual organization and the leadership at hand, and what is their mandate and how they are moving through it. I've worked in organizations that are very laissez-faire and others that are very focused on metrics and results, and they have a board that's on the case of the management, and they're in a change agenda. So it gets back to a point you've often made, Perry, about the importance of leadership. And I was going to say also to Sabrina, I'm kind of shocked in the newsletter and also all of this discussion in relation to individual obesity or weight management that no one has mentioned Wegovy or Ozempic, which is like a revolution in this world like we have never seen before. And there are new and better drugs coming. They're GLP agonist, they're ghrelin agonists that suppress appetite. And so I wanted Sabrina to comment on that. And then also for Peter and Dawn, is there an analog to an Ozempic in the public sector or the private sector? Like, is there something that we could draw upon that would reduce our desire to consume or to use more than we need? Is there any analog to that? I'm just looking at that positive example that's happening right now in medicine.
Okay,
Truly
Sabrina,
revolutionary.
do you see what role do you think Ozempic has or these medications have in the future of obesity?
So I think they were quite revolutionary because we understood more about the actual physiology of weight control by the mechanism of these medications, as opposed to like the medications that we had in the 80s and 90s. Though I use these medications day in and day out, and they are very effective with patients, I would say it's really a band-aid. It doesn't address the real underlying issue and why we're seeing a explosion of obesity. You know, the issue still needs to be treated. So this is like a treatment, but I don't see it as the actual solution. So as effective as they are and as strong as they're becoming, I don't think this is really the end solution. It's just sort of, yeah, like a Band-Aid. And I will say that I have lots of patients that come into our program here, our clinic here, who have already tried the medication. And they said, it doesn't work for me. I didn't get any kind of result. Their result is I didn't lose any weight. And a lot of times that actually comes down to, again, education. So their nutrition is not adequate to actually support any kind of loss, or their use of the medication was not properly monitored or managed. And so they ended up having a whole bunch of side effects and couldn't tolerate. So I think even with the medications, there does need to be an understanding of how does this work, how is it used, and how is it used properly.
The point that you're making is absolutely fundamental. We could even wrap the session up here. Obesity is a symptom of a problem. And Ozempic is hiding that, is covering up that symptom. The problem still remains, in which case you as a person dealing with another person need to help them get to the core issue and appreciate that obesity is just a symptom of another problem. Do you work with psychologists, for example? Do you work with other professions?
Absolutely.
Okay, terrific. Before I call on you, Sabrina, Jeff posed a question to Dawn or Peter. Dawn, do you want to answer that?
Is there anything in the public or private sector that would likewise reduce that initial desire?
I think it's very related to developing good habits, you know, because it's really formulaic, you know, in business anyway. If you use the practices that are common to high-performing organizations, you develop a culture that's really committed to excellence. People in the organization are always saying, what are we doing now? How can we do it better? And you go on to achieve exceptional results across a balanced system of measurement. It's very formulaic. And I've got a publication on my website that shares all of this for those that want to do it themselves or take some training or use some consulting services. And I'm overjoyed to hear that there's companies around the world that are doing it themselves, and they're increasing revenue 3 to 4 times, and they're getting some really great results.
Okay, so your recommendation in education is adopting a process. Trump, for example, in the US is not introducing a process. He's doing structural change.
Yeah, he is.
We often talk in consulting that you don't change a culture by making a structural change. That culture will live on. And at some point in time, a process needs to be introduced to re-educate or hire differently. Peter, anything you want to add here regarding Ozempic for the public sector?
In regard to the public sector, I don't think there's any particular ideology that, I mean, we've gone through various types of matrix management styles and things of that sort that government has sometimes embraced, but they also were in the private sector before government in general. I do think, though, that government, in regard to the issue of obesity anyway, and the downsizing as a consequence, so growth and shrinkage, is actually best measured by looking at the Overton window. So, in other words, it's the number and a variety of policies at any one time that a government could probably get away with executing based on its voter base and the ideas of the country at that moment. Because keep in mind, these policies can shift, as I was saying, this window can slide open and it can narrow, and it moves to the left and it moves to the right, or it sits over center or center left or center right. I mean, this is a way of looking at how a government and a large dynamic mass as a nation state, how it's actually, daily popping around. And I think this is a good way to measure, because governments don't do things fast.
Sure.
And I think it's wise in most cases. They don't do things fast. Sometimes it's obvious for emergency reasons to do things fast, but that should also require planning, such as pandemic planning, which we had lots of pandemic planning, but we didn't seem to follow the plans.
Right. Well,
And we got into, administrative issues about responsibility and hierarchies, and the whole issue of change management, how to change fast.
Well, we've seen in democracy the equivalent of revolution is an election. So if things get out of hand, at some point in time, one expects to see a revolution in the sense of a new party, a new ideology. Sabina, you've got your hand up.
Yeah, I'm fascinated by the metaphor use in business and government of obesity, having been a public servant in leadership for over 20 years. And I think everything is relative to the service that's being provided and the demand that's being expected at that point in time of whatever the situation is. So, and yeah, I'm not debating that there is fat in the system, and that is, to me, often a reflection of the leadership and management of an organization and not staying on task with what the goals and objectives are. So that's where that accountability is upward moving. But there are a lot of pressures on government today in both federal and provincial sectors to meet the pressures of what's happening, and we need more people to provide those services. But again, it's relative to what is that service, especially when it's on the front line.
That was timely.
Thank
Shirley, and then I'll do a wrap up. Go ahead, Shirley.
Yeah, I wanted to mention, I haven't been with the public service for long. I primarily was working for private business, and it is certainly a different environment. I think what obesity has in common personally and in the government is related to addiction, and as Sabrina mentioned, to stress as well. We start to develop unhealthy habits, both personally and within the government, and also with the increasing demands. Nobody really wants to say no. And particularly with government, once there's a program and people get used to this program, it is really hard to take it away. And I don't know what's going to happen with this tariff situation and further demands on our economy. But it is going to be hard to say, well, we've got to make these cuts. And we know from previous decades how painful those kind of cuts can be, whether it's government cuts or even to change your own personal eating habits. It's very difficult.
Well, in a wrap up, over the last 100 years, as government has grown and as corporations have flourished and as new professions have emerged, we've lived in this, in a way, a golden age. Technology has evolved. The capacity of the taxpayer to finance public services has grown. And there's no telling whether or not we're at an end or pivoting or transitioning. But the only one who really didn't have an answer for where is the Ozemka is in government. And I think there is something emerging, and we'll talk about it next week, and that's AI. It's quite conceivable that the journey that we've been discussing today of excesses is unresolvable at the human level. That the managing of expectations by our institutions and by our professions has become almost impossible. The number of programs that have emerged in these 100 years and the amount of money being spent and the increasing expectations of government to take care of us can't go on forever. And it is conceivable that AI is arriving at just that very time when organizations are starting to say, we can't stop. We need help. And I'm not quite sure whether everybody wants an Elon Musk or wants an AI as a solution, but something is out there right now making significant promises of being able to replace people in organizations. So I'm going to leave it at that, having set the tone for what we will be discussing next week. But I want to thank you, Peter. I'll let you have the last word. I want to thank you, Sabrina, very, very much. Kwon, I know you may have been a little apprehensive to join the community and have a discussion about something that you're well versed in, but about something you're not so well versed in. So hopefully you got something out of this as well. And Dawn, always a pleasure. Thank you very much for joining us with that, without hesitation. Peter, something you want to add here?
Something that none of us has said in the course of this conversation today, and I think it's a very important point. I think that the downsizing or upsizing, whatever which way you want to go with respect to government, specifically government, will be a massive improvement in effectiveness and efficiency of government by going digital. So this is playing to your AI, but it's broader than that. I think that government services are ideally suited to be in a digital world, and that the coordination of programs in our country at both all levels of government could be better integrated. And so all of that is, again, a digital world. So there's a huge transition to be had there, and plays to the kind of organizations that Dawn's consultancy would, be pleased to help transform, I'm sure. But I think that this is the future, and government is embracing more digital.